I'm going to take you through the overall numbers of COVID-19 that stands as of today in India. We've seen a significant drop in the COVID numbers. Here are the numbers as of today. We're looking at as of June 13, 2021. So far, the active cases in the country now stands at 10,26,159. Taking you through the death toll in the country as of today, we're looking at the death toll in totality, which now stands at 3,70,384. We're looking at the recovered numbers, a significant improvement. So far, total recovered numbers since the pandemic began now stands at 2,80,43,446. Now, these are the overall numbers as of today given in by the Health Ministry that's come in. We're looking at discharged numbers only on the rise, with active cases now dropping significantly. Now, as COVID cases continues the downward trend in the national capital, Delhi Chief Minister Arvind Kejriwal has now announced more relaxations from the curbs. As per the new guidelines, all the markets and malls will now be open between 10 a.m. to 8 p.m. from tomorrow. Restaurants and public transport will be allowed to run with 50% capacity. Public transport can ply with half the seating capacity, and only 2 passengers are allowed in auto rickshaws and taxis. However, this is being permitted for 1 week on a trial basis. If cases increase, then the government might impose stricter restrictions. He's further announced that social, political and religious gatherings have been prohibited. Weddings will not be allowed in public places like banquet halls or hotels. In fact, it will be permitted only in closed spaces with not more than 20 people. Spas, gyms, yoga institutes, parks and gardens will remain closed for public to break the chain of the virus.
कल 5 बजे के बाद से सारी एक्टिविटीज़ अलाउड हैं, एक्सेप्ट कुछ एक्टिविटीज़ हैं जो बिल्कुल प्रोहिबिटेड हैं, वो बिल्कुल अलाउड नहीं है, और कुछ एक्टिविटीज़ हैं जो रिस्ट्रिक्टेड तरीके से अलाउड हैं। सारे स्कूल बंद रहेंगे, कॉलेज बंद रहेंगे, एजुकेशनल इंस्टीट्यूशंस बंद रहेंगे, कोचिंग इंस्टीट्यूशंस बंद रहेंगे। सोशल, पॉलिटिकल, स्पोर्ट्स, एंटरटेनमेंट, एकेडमिक, कल्चरल, रिलीजियस, फेस्टिवल, इससे रिलेटेड जितनी गैदरिंग्स हैं, कोई भी गैदरिंग अलाउड नहीं हो।
ये तो गुड न्यूज़ है, और हम चाहते कि हमारा क्लाइंट एज यूजुअल पहले जैसे आ जाए। हमसे जो हो पाएगा वो हम कर रहे हैं, गुड प्रिकॉशन कर रहे हैं, डिस्पोजेबल यूज़ कर रहे हैं, सैनिटाइजर कर रहे हैं, टेम्परेचर नाप के ही अंदर आने दे रहे हैं हम सब क्लाइंट को।
एक छोटी सी पहल की थी हमने, लोग घबरा रहे हैं, जो यंग लोग हैं वो घबरा रहे हैं वैक्सीन लगवाने में। तो जितने भी यंग हैं उन्हें बाहर का फास्ट फूड खाना बहुत पसंद रहता है, तो इससे एक तो लोगों को वैक्सीन लगाने का मौका मिलेगा, वो यहाँ सर्टिफिकेट दिखाएंगे, उनको 20% का डिस्काउंट मिलेगा, और अपने लिए एक संकल्प है कि स्वस्थ रहेंगे और अपने लिए ठीक रहेगा कि वैक्सीन लगवा कर हम स्वस्थ रहेंगे। घर वालों के लिए, उनके लिए, जितने युवा पीढ़ी घबरा रही है, तो इससे हमारे को भी मोटिव मिलेगा, उनको भी मोटिव मिलेगा आगे के लिए, पहल के लिए।
लंच लेने के लिए आया था, तो मैंने अभी ऑर्डर लगाया, तो मैंने यहाँ पर देखा कि इनका एक पोस्टर लगा हुआ था, तो मैंने इनको वैक्सीनेशन का सर्टिफिकेट दिखाया, तो जो मेरा 500 रुपये का बिल था वो 400 रुपये का हो गया आफ्टर 20% डिस्काउंट। भैया ने इंस्टेंटली डिस्काउंट दे दिया था सर्टिफिकेट लगाने के बाद। तो बड़ी अच्छी पहल है, इससे लोग जागरूक भी होंगे, जैसे हम जैसे युवा एक मोटिव मिल जाता है कि हाँ जी, खाने पीने के सब शौकीन हैं, तो एक अच्छा लगता है। और अच्छी पहल करी है इन्होंने कि शायद जमुना पार में अभी तक किसी रेस्टोरेंट ने ऐसा किया भी नहीं है।
Now, Delhi restaurants are all set to reopen with 50% seating capacity. My colleague Pankaj Jain brings to you updates from Delhi's Pandara Road. Let's cut across.
दिल्ली में रेस्टोरेंट संचालकों के लिए राहत की खबर है। 50% क्षमता के साथ अब रेस्टोरेंट खुल सकेंगे। अब तक जो व्यवस्था रही है उसमें रेस्टोरेंट में खाना तो बन रहा था, लेकिन सिर्फ टेक अवे के लिए, यानी कि तस्वीर के जरिए हम आपको समझाते हैं। यहाँ पर आप देख रहे हैं जो डिलीवरी बॉय यहाँ पर खड़े हैं वो खाना लेकर अलग अलग जगहों पर पहुँचाते थे, लेकिन अब जो परिवार हैं वो रेस्टोरेंट में आकर खाने का लुत्फ ले सकेंगे। और रेस्टोरेंट संचालकों के लिए ये नियम जारी किया गया है कि रेस्टोरेंट में जितनी भी सीट्स हैं उसमें 50% क्षमता के साथ ही लोगों को बैठाना होगा। हम इस वक्त पंडारा रोड में मौजूद हैं, यहाँ पर कई रेस्टोरेंट हैं। हालांकि यहाँ पर अभी परिवार जनों की आने की अनुमति नहीं है, यानी कि यहाँ लोग आकर अंदर बैठकर खाना नहीं खा सकते हैं। लेकिन अब ये सुविधा दे दी गई है क्योंकि कोरोना के मामले कम हो रहे हैं और एक हफ्ते के ट्रायल बेसिस पर दिल्ली में रेस्टोरेंट्स को खोला गया है।
Now cutting across to Kamaljeet Singh live from Delhi. Kamaljeet, here's Delhi already set to unlock, but of course very cautiously. SOPs in place in several industries to be following it. Is Delhi prepared?
Well, Delhi is looking forward to move on, especially after horrid time for over a month. We were looking at ICU beds, a lack of oxygen. So this is something which has scarred the Delhiites for a very long time now. But it's time to head back to normalcy. The new normal in times of COVID is obviously a lot of precaution, a mask. And now what the government is saying is that the restaurants and the shops, all of them have some sort of relief. Remember, the businesses have suffered. So yes, the restaurants will open from 10 to 8 p.m. and we are also looking at 50% capacity. They will ensure that all norms are followed. We're talking about the weekly markets. There will be relief provided to them as well. However, large segments of activities, including educational institutes, schools, colleges, we're talking about saloons, barber shops, we're also talking about gym spaces, all these will be closed. Office spaces will be allowed to work with 50% capacity. So this is a time where Delhi is looking at resumption of activities, but with a lot of caution. This is where remember, the business houses have been affected, people not coming out in the market, not shopping. That has brought in a lot of losses. We know there have been mass layoffs by several companies. So once there is a resumption of economic activity, people can look at relief and perhaps a new sense of normalcy.
Thank you very much for joining us with those details. Now, I'm going to quickly take you through what's allowed, what's not allowed in Delhi from Monday 5 a.m. onwards. We're looking at all markets, of course, that will be allowed to open. Standalone and neighborhood shops, of course, will be allowed to open from 10 a.m. To 8. Restaurants will now be allowed only with 50% seating capacity, and that's a strict rule. Wedding at home will be allowed with only 20 guests. We're looking at metro and buses only with 50% capacity will be allowed. Of course, even other public transport like autos and taxis will be allowed with only strictly 2 passengers. Funerals, if you are attending one, of course, only 2 people will be allowed for any funeral within the state. We're looking at these facilities that will be allowed starting Monday. We're going to take you through what's not allowed. Of course, schools and colleges still strictly closed. It's not going to be allowed to open. Social, political, sports, religious gatherings strictly closed, not going to be allowed. Swimming pools and stadiums will remain shut for a little longer. We're looking at movie theatres and multiplexes also will remain closed for some time more. Banquet halls and auditoriums, no large gatherings, therefore banquet halls, auditoriums will not be allowed to open. We're also looking at spas, gyms, yoga centres, which will still remain shut for a little longer. Public parks and gardens will also be closed. Now, private hospital operators are calling for a review of the government's new vaccine procurement policy, claiming that the high vaccine prices set for private sector and a cap on service charges will make it really unviable for them. Milan Sharma there, bringing us more with those details.
This first drive-through vaccination centre in Delhi was inaugurated to vaccinate Delhi's population. But after the union government capped vaccine prices in private hospitals, this drive-through centre is being shut down by the hospital.
जो नई प्राइस कैपिंग आई है, उसके कारण ये हमारे लिए थोड़ा अनवायबल हो गया है, जबकि पिछले 15 दिन से हमने इसको लगातार चलाया और हम इसको और भी चलाना चाहते थे, लेकिन अभी फिलहाल इसको हमें इसको बंद करना पड़ेगा.
Fortis Healthcare has also issued a similar statement seeking a review of the government's new policy on price cap for private facilities. It said, and I quote, "We would urge the vaccine prices for private sector be reviewed Unfortunately, the cap of service charge at 150 rupees will not cover additional costs incurred for off-site vaccination camps. We urge the government to consider a higher charge for off-site camps to enable expanded coverage. The government has capped the prices of Serum Institute of India's Covishield at private COVID vaccination centres at 780 rupees per dose. It capped the prices of Bharat Biotech's Covaxin at 1,410 rupees per dose and Russia's Sputnik V at 1,145 rupees per dose. It's also said that private hospitals cannot charge more than 150 rupees for administering a dose. Healthcare industry bodies say the centre should procure all the vaccines.
We urge Prime Minister to procure 100% vaccine from the manufacturers and provide 50% vaccines to the private sector. AHPI, for example, have 11,000 hospitals, many of which are located in Tier 3 towns. They will be able to provide vaccines to the people and overcome the hesitancy.
This would help even small private hospitals to procure doses to vaccinate in small towns as well as rural India.
The central government has made it very much clear that 75% of the COVID-19 vaccine will be made available to the government sector and rest 25% will be made available to the private hospitals. Yet the government has made it clear, but there is no official channel from where the smaller hospitals can procure the COVID-19 vaccine.
Healthcare body sources have said that it seems private hospital concerns have been completely ignored in the new policy. And the Union Health Ministry has told states that strict action needs to be taken against those that are overcharging for vaccines. While we have conveniently forgotten, for several weeks, it was the private hospitals that were procuring higher doses from the central government to vaccinate at least those who could afford to get inoculated in the country, while states miserably failed to procure these doses. In New Delhi with Sneha Mordani, this is Milan Sharma for India Today.
Now, the Delta variant, which was first detected in India, is now spreading at an alarming pace. It causes illness, of course, the symptoms of which are now unexpected, many of which Sneha Mordani explains to us.
The dreaded Delta variant, first detected in India, is now a global worry with alarming spread, forcing the World Health Organization to tag it among 4 global variants of concern last month. New variant, new symptoms. Not so common symptoms such as hearing loss, severe stomach upsets and blood clots leading to gangrene are being reported among COVID-19 patients infected by the Delta variant. Worsening blood clots. Doctors and researchers believe that increase in hospitalization was also because of the blood clots triggered in the chest by this variant, even if affected patients had no clot-related problems previously. Doctors have also detected instances of clots in blood vessels that supply the intestines, causing stomach pain. What about greater risk to children? The alarming rate at which the Delta variant is infecting children has also left medical professionals worried. During India's second wave, doctors say they were witnessing more cases of household transmission instead of individual transmission than last year. Delta variant versus other variants. The World Health Organization has said the Delta variant was more dominant than the Alpha variant, which was detected in the United Kingdom last year. The Delta variant reported in over 60 countries now and is the leading cause of COVID hospitalizations in the UK, for example. Some experts suspect that COVID-19 vaccines too have reduced effectiveness against this variant, resulting in higher risks.
And now on to our COVID heroes versus villains segment. There are 2 videos on your screens here. The left one is from Srinagar, Jammu and Kashmir, where Army dedicated a 50-bed COVID-19 hospital to citizens. It has 10 ICU beds with ventilator support, 20 high dependency unit beds with oxygen support and 20 oxygen beds for efficient management of patients. And on your right are visuals from Sadar Hospital in Kaimur, Bihar, where thousands of desperate women gathered to apply for the post of nursing staff. Everyone in the crowd can be seen jostling each other. There is no sign of social distancing and few can also be seen without masks. But who is to blame here? Should we, in fact, blame the people itself who are gathering there out of sheer desperation for need of a job? Or should we blame authorities who are responsible to enforce COVID guidelines? Is the question. Now, on May 22nd, a woman under suspicious circumstances went missing from one of Chennai's biggest hospitals. A few weeks later, her decomposed body was found on the 8th floor of the same hospital. Our next report here tells you more.
This is 41-year-old Sunitha, who was admitted to Chennai's Rajiv Gandhi Government Hospital on May 22nd after having breathing difficulties. After giving her lunch that day, her husband Molly left for home, and that was the last time that he saw his wife. Shockingly, Sunitha went missing from the hospital the very next day, and authorities were clueless about her whereabouts. Her mysterious disappearance took a tragic turn when on the 8th of June, Sunitha was found dead and lying decomposed on the 8th floor of the very same Rajiv Gandhi Hospital. Her husband narrates the horror.
First I asked to the doctors. They told absconded by then.
And then?
First I didn't believe how she absconded and all. So that's why, because of suspect and all, I gone to the police and complained. And on 8th again I gone there. On 8th day I think I identified the dead body on 8th floor.
What's worse is the bizarre defense by the hospital.
And she was not found in the body.
Okay.
So they have intimated to the police memo, RMO and everything. Police was intimated. Only way she could have entered into the place is only by the lift.
Tamil Nadu government has now stepped in with the health minister promising action.
Police investigate பண்ணிருக்காங்க அது அவங்களோட அறிக்கைக்கு பிறகு நடவடிக்கை எடுக்கும்.
Right. A patient admitted to Rajiv Gandhi Hospital on 21st May night went missing on 23rd, only to be recovered as a decomposing body on 8th June. The matter has become big and the health minister claims that they are waiting for the police report to take appropriate action while the patient's family is grieving, trying to find out what exactly happened. With video journalist Divyan, Pramod Madhav for India.